mode.
Understanding Psychosis, Mental Health First Aid, presented by Lee Trotter Carew. Caitlin, it won't advance. Caitlin, it wouldn't advance again, but now it's advancing. So we need to start over, I guess. That is weird. Understanding Psychosis, Mental Health First Aid, presented by Lee Trotter Carew. Psychotic illnesses are perhaps the most misunderstood and misrepresented of all mental illnesses. This lack of understanding often leads to fear, ignorance, and stigmatizing attitudes. Psychosis is a general term used to describe a mental health problem in which a person has lost some contact with reality, resulting in severe disturbances in thinking, emotion, and behavior. Psychosis can severely disrupt a person's relationships, work, and usual activities. Self-care can also be difficult to maintain or even initiate. Psychotic disorders are the least common of other mental health disorders. There are numerous disorders in which a person can experience psychosis, including schizophrenia, bipolar disorder, psychotic depression, schizoaffective disorder, drug-induced psychosis, and delirium. People usually experience psychosis in episodes. A first episode of psychosis is very frightening, confusing, and distressing, particularly because it is an unfamiliar experience. Approximately 3 out of every 100 people will have a psychotic episode in their lifetime. Psychosis occurs in men and women and across all cultures and social economic groups. Psychotic illnesses seem to affect women at a later age than men, when women may be farther along in their social and work lives. On the whole, women respond better than men to most treatments. However, women have times when the risk of relapse is much greater. People in the early stages of psychotic illnesses often go undiagnosed for a year or more before receiving treatment. A major reason for this is that psychosis often begins in the late adolescence or early adulthood, and early symptoms have involved behaviors and emotions that are common to this age group. Many young people will have some of these symptoms without developing a psychosis. Psychosis can come on suddenly or can develop very gradually. Symptoms of psychosis can vary from person to person and may change over time. Some common symptoms are depression, anxiety, irritability, suspiciousness, blunted or flat or inappropriate affect, changes in appetite or reduced energy or motivation. The word depression is usually used in many different ways. People feel sad or blue when bad things happen. However, everyday blues or sadness is not a depressive disorder. We all may have a short-term depressed mood, but we cope and soon recover without treatment. A major depressive disorder lasts for at least 2 weeks and affects a person's ability to work, to carry out usual daily activities, and to have satisfying personal relationships. A person who is clinically depressed would have at least one of these 2 symptoms nearly every day for at least 2 weeks. And those 2 symptoms are an unusually sad mood or the loss of enjoyment and interest in activities that used to be enjoyable. A person might also have some of these symptoms as well: lack of energy and tiredness, feeling worthless or feeling guilty, though not really at fault, thinking often about death or wishing to be dead, difficulty concentrating or making decisions, moving more slowly or sometimes becoming agitated and unable to settle, having sleeping difficulties or sometimes sleeping too much, and they also might experience a loss of interest in food, or sometimes they'll have a larger issue, meaning that they have a bigger issue with food. So these changes in eating habits may lead to either loss of weight or weight gain. Everyone experiences anxiety at some time in their life. Anxiety can be quite useful in helping a person to avoid dangerous situations and even motivate the solving of everyday problems. Anxiety may vary from severity, from mild uneasiness to terrifying panic attacks. Anxiety also can vary in how long it lasts, from a few minutes to many years. An anxiety disorder differs from normal anxiety in the following ways. Anxiety disorder is very intense, much more intense than everyday anxiety. And anxiety disorders last a long time. It's long-lasting. It also interferes with the person's work, activities, and even relationships. There are also physical symptoms of anxiety, such as pounding heart, chest pain, rapid heartbeat, even flushing of the face. There's also hyperventilation, shortness of breath. People can experience dizziness, headaches, sweating, tingling, numbness, even choking, dry mouth, stomach pains, nausea, vomiting, and diarrhea. We can also experience muscle aches, pains, especially around the neck, the shoulders, and the back. We can experience restlessness, tremors, and shaking, and inability to relax. Blunted affect is a scientific term describing a lack of emotional reactivity on the part of an individual. It is manifested as a failure to express feelings either verbally or non-verbally, especially when talking about issues that would normally be expected to engage the emotions. Expressive gestures are rare, and there is little animation in facial expression or vocal inflections. Concentration difficulty is a decreased ability to focus thoughts on something. Concentration difficulties can be related to difficulties staying awake, impulsiveness, intrusive thoughts or concerns, overactivity, or inattention. A sense of self is an awareness of one's physical body and mental state. It encompasses one's personality, perceptions, and emotions. It also reflects one's conscious decisions and actions. It is believed that to have a sense of self, it is to be combined with one's inside awareness with one's outside awareness. So alterations in self can be painful for the individual because of a confused sense of what is going on the inside and what's going on the outside of the body and mind. A person who is suffering from an episode of psychosis can have problems recognizing what is real and can have difficulty thinking clearly as they normally would. When someone is affected in this way, they may have unusual or strange ideas. They may hear or see things which are not real, and they may have problems managing their emotions. They may also have difficulties organizing their thoughts so that their speech may seem disorganized and illogical at times. Symptoms with behavioral symptoms. We can have sleep disturbances, we can have social isolation, or we can withdraw, and we can have the reduced ability to carry out our work and social roles. So sleep disturbances, the person can go for days with little or no sleep. Social withdrawal, the person may withdraw from contact with everyone, even family and close friends. There may be a number of factors that lead to this withdrawal, such as loss of drive, delusions that cause fear of interacting, difficulty concentrating on conversations, and the loss of social skills. Some examples of what socially isolating oneself can mean are staying home, having no communication with anyone, including friends and family, and basically avoiding any contact with other beings. If there is a social contact with another person, then it's most likely very concise and short and very needed. Emotional or psychological challenges are the result of this social isolation. These results can cause symptoms of feeling depressed, distressed, or anxious. This causes feelings of loneliness, fear of others, or negative self-esteem. Needless to say, with these multiple hardcore symptoms, it would be very hard for a person to hold a job or even be the president of the local garden club. It is believed psychosis is caused by a combination of factors, including genetics, biochemistry, and stress. Biological factors could be genetic vulnerability, changes in the brain, or dysfunction in the neurotransmitters in the brain. Stress or drug abuse may trigger the psychotic symptoms in vulnerable people. There are many types of psychotic disorders, and these are just a few. There's schizophrenia, bipolar disorder, psychotic depression, psychoaffective disorders, and drug-induced psychosis. The term schizophrenia is from Greek roots, to split or to fracture, and phren is the mind. The DSM defines schizophrenia as a disorder that lasts at least 6 months and includes at least 1 month of 2 or more of the main characteristic symptoms of schizophrenia, like delusions, hallucinations, disordered speech, grossly disordered behavior, and negative symptoms. Schizophrenia affects 2.4 million Americans each year, about 1.1%. Most experience their first episode of schizophrenia between the ages of 15 and 30. Schizophrenia knows no racial, cultural, or economic boundaries. It affects males more than females, and males tend to develop it earlier. The onset of illness may be rapid, with symptoms developing over several weeks, or it may be slow, developing over months or even years. Approximately 1/3 of people who develop schizophrenia have only one episode and fully recover. Another 1/3 have multiple episodes but feel well in between episodes. And the last 1/3 have a lifelong illness. For them, schizophrenia may indicate or dictate a deteriorating or unrelenting course of their lives. People in this final group are the least likely to own their own home, to marry, and to have children, or even hold down a job. They are the ones most likely to be homeless. Symptoms of schizophrenia may be delusions, hallucinations, difficulties in thinking, loss of drive, blunted emotions, and social withdrawal. Delusions are false beliefs of persecution, guilt, having a special mission, or being under outside control. Although the delusions may seem bizarre to others, they are very real to the person experiencing them. Hallucinations most commonly involve hearing voices. It can also involve seeing, feeling, tasting, or smelling things. These are perceived as very real by the person, but are not actually there. Hallucinations can be frightening, especially when voices are saying negative things. The person may hear one or more voice, or additionally experience many types of hallucinations. Because delusions and hallucinations seem so real, it is common for people with schizophrenia to be unaware that they're even ill. Difficulties in concentration, memory, and the ability to plan, making it difficult for the person to reason, communicate, and to complete daily tasks. Loss of drive is the lack of motivation for even self-care. And this is not laziness, this is a symptom. Blunted emotions. The person seems oblivious of things around them and often reacts inappropriate. Examples may be speaking in a monotone, lack of facial expressions or gestures, and even lack of eye contact. Social withdrawal is the isolation process. For somebody with a parent or a sibling with schizophrenia, the risk is around 10 to 15%. Although the risk is higher, it is important to note that 85 to 90% will not develop schizophrenia. Males are more likely to develop schizophrenia and tend to have an earlier age of onset. People who are born and grow up in urban areas are at a higher risk than those from rural areas. The reason is unknown, but could be related to the differences in the health of mothers during the pregnancy, or marijuana use, or even social stressors. Immigrants and children of immigrants have increased risk. The reason is really unknown, but social stress from feeling like an outsider could be a factor. Social stressors can also trigger the onset of schizophrenia. Marijuana use during adolescence increase risk, particularly in people who have other risk factors. Infections of the mother in the first and second trimester of pregnancy have been linked with a higher incidence. A possible explanation is that the mother's immune response interferes with the brain development of the fetus. Severe nutritional deficiency and a very stressful life event during pregnancy might also increase the risk. A range of complications is associated with doubling the risk, perhaps because of lack of oxygen to the infant's brain. Birth during the late winter or early spring is associated with about 5% to 10% greater risk. The explanation is not known, but may be related to infection, malnutrition, or the risk of genetic mutation. Older age at the time of conception roughly doubles the risk. The explanation is again unknown, but may be related to impaired sperm or genetic mutation. There are many effects of schizophrenia: emotional, behavioral, thinking, and others. Just think of all of our emotions. We can experience anxiety, depression, fear, even terror and paranoia during schizophrenia episodes. Behaviorally, we can actually almost feel paralyzed We feel secretive. We withdraw ourselves. And of course, we're isolated. Sometimes we're even hypervigilant because of suspiciousness. We have also thinking difficulties. Sometimes we have feelings of guilt, and oftentimes we're illogical. It also affects our relationships, our work, and even the ability to earn our income. Bipolar disorder. Classical bipolar disorder is characterized by episodes of mania and episodes of depression. In a manic state, a person may have extreme euphoria or optimism to the point of impairing judgment. They may be hyperactive and stay up all night, talk and move extremely fast, have increased sexual drive, and decreased inhibitions. 75% of manic disorders or episodes include delusions of some sort, and most of these are often delusions of grandeur. And this is one of the reasons why it is sometimes confused with schizophrenia. Untreated manic episodes can last for weeks and even months. Conversely, though, during a depressive episode, the same person can feel hopeless and personally worthless. They may have lost interest in their normal activities, including sex, have very little energy or motivation, be unable to concentrate, may have disturbances in sleep and the eating habits. Mania and depression do not necessarily follow one and the other. Sometimes a person may experience a long symptom-free period before having another mood disturbance. Although bipolar disorder is defined as a mood disorder, it is quite common for some psychotic symptoms to be experienced during the depressive and manic episodes. The time between episodes of mania and depression and the normal mood can vary greatly from person to person. The depression experienced by a person with bipolar disorder has the same symptoms as clinical depression. It can take bipolar disorder a long time to be diagnosed correctly because the person must have had episodes of both depression and mania. The causes of bipolar disorders are not fully understood. However, the following factors are believed to be involved. Having a close relative with bipolar disorder, this may or is the most important risk factor known. Someone with a parent or a sibling affected has around a 9% risk. While this is an increased risk, it means that more than 90% of people with an affected relative will not develop the disorder. No other risk factors are firmly established. However, there are some research supporting the following. Pregnancy complications. These complications may affect the developing brain of the fetus or infant. Birth in winter or spring. This may affect or reflect risk to the fetus from infections or other events that vary by season. Social situation. People who develop bipolar disorders are more likely to have lower income, be unemployed and single, and live in urban areas. However, these factors may be consequences of the early changes produced by bipolar disorders rather than causes. Recent stressful events. Stressful events are more common in the 6 months before onset of an episode of bipolar disorder than in people in general. Recent childbirth. Women appear to be at increased risk in the months following childbirth. Brain injuries. Brain injury before the age of 10 may increase risk. MS, multiple sclerosis. People with multiple sclerosis may have an increased risk. Similar to schizophrenia, The risk factors for bipolar disorder can lead to biochemical changes in the brain which produce mania and depression. Characteristics of mania: increased energy and overall activity, elated mood, needed less sleep, irritability, rapid thinking and speech, lack of inhibitions, grandiose delusions, and lack of insight. Elevated mood: the person will feel high, happy, and full of energy, on the top of the world, invincible. There's no need for sleep. They may stay up all night for many days, cleaning, painting, or doing laundry or other things. Irritability: this may occur if others disagree with the manic person's unrealistic plans or ideas. Rapid thinking and speech: the person may talk too much, too fast, and keep changing topics. Lack of inhibitions: the person may disregard risk, spend money extravagantly, or be very sexually active. Grandiose delusions: these involve very inflated self-esteem, such as a belief that the person is superhuman, especially talented, or an important religious figure. Lack of insight: the person is so convinced that their manic delusions are real that they do not realize that they are really ill. There's also excessive behaviors like extreme spending or charging well beyond one's means, or having sex with casual acquaintances. They may overextend themselves. They have a higher estimation of themselves, which leads to the commitments that they can't possibly keep, such as taking on jobs that they don't have the skills to do. Bipolar disorder is diagnosed in a little more than 1% of the population, with males and females being equally affected. It is commonly first diagnosed when people are in their 20s. There are other psychotic disorders such as psychotic depression, schizoaffective disorders, and drug-induced psychosis. Major depression with psychotic features is a mental disorder in which a person has depression along with loss of touch with reality, and that's the psychosis part. The cause is unknown. A family or personal history of depression or psychotic illness makes us more likely to develop this condition. The symptoms are: people with psychotic depression have symptoms of depression and psychosis. Psychosis is a loss of contact with reality. It usually includes the delusions and the hallucination. And delusions are the false beliefs about what is taking place or who one is. Hallucinations are seeing or hearing, tasting, anything that involves our senses that really aren't there. The types of delusions and hallucinations are often related to the depressed feelings. For example, some patients might hear voices criticizing them or telling them that they don't deserve to be alive. The person may develop false beliefs about their body, for example, that they have cancer. Schizoaffective disorder is a chronic mental health issue marked by symptoms of both mood disorders and psychosis. For example, seeing or hearing things that are not there. Some symptoms of schizoaffective disorder can cloud a person's thinking and judgment and can affect how a person relates to others. Managing emotions may also be difficult. The mood symptoms in schizoaffective disorder may be depressive, manic, excessive excitement, or a combination of both. Schizoaffective disorder is a distinct mental disorder. Often people who have it have been diagnosed with other mental illnesses in the past because its symptoms can be similar to schizophrenia, depression, or bipolar disorder. Schizoaffective disorder is a lifelong illness that can affect other areas of daily living. Schizoaffective disorder can go unrecognized because some of the symptoms may mimic other illnesses. Drug-induced psychosis. This is a psychosis brought on by the use of drugs. The symptoms usually appear quickly and last a short time, from a few days to a few hours, until the effects of the drugs wear off. The most common symptoms are visual hallucinations, disorientation, and memory problems. Drugs that can cause psychosis are marijuana, cocaine, ecstasy, and speed or amphetamines, and some species of mushrooms. It can be a reaction to many other commonly prescribed drugs as well, like prednisone, for instance. It is important to realize that drug-induced psychosis can also be an untoward reaction to prescription drugs. Although drugs can sometimes be the sole cause of psychosis, in other cases they can trigger other psychotic illnesses such as schizophrenia in someone who is vulnerable to it. People sometimes take drugs as a way of coping with a developing psychotic illness, but these drugs can make the symptoms worse and the disorder difficult to diagnose. Early intervention for people with psychosis is most important. Research has shown that the longer the delay between the onset of psychosis and the start of treatment, the less likely the person is to recover. Other consequences of delayed treatment include poorer functioning, increased risk of depression and suicide, slower psychological maturing, strain on relationships, disruption of education and employment, increased use of alcohol and other drugs, loss of self-esteem and confidence, and greater chance of problems with the law. Treatment options. There are plenty of treatment options out there for psychosis, schizophrenia, and bipolar and other mental health issues. The pattern of recovery from psychosis varies from person to person. Some people recover quickly with little intervention. Others may benefit from support over a long period. Recovery from the first episode usually takes a number of months. If symptoms remain or return, the recovery process may be prolonged. Some people experience a difficult period lasting months or even years before effective management of further episodes of psychosis is achieved. Most people recover from psychosis and lead satisfying and productive lives. There is a range of treatments that have good evidence of effectively treating psychosis. In the past, people with schizophrenia were considered to have chronic illnesses with no hope of recovery. It is now known that people who get proper treatment can lead productive and fulfilling lives. In fact, research has demonstrated that recovery is possible with medication and psychosocial rehabilitation programs. People with schizophrenia and other psychotic disorders need to be treated with optimism for a good outcome. They need to live in a stable and secure social environment. This includes a pleasant home environment, support from family and friends, and an adequate income, and a meaningful role in society. There is evidence that the following specific treatments help people with schizophrenia. Antipsychotic medications. These are effective for psychotic symptoms such as delusions and hallucinations. However, they are less effective for other symptoms such as lack of emotion, motivation, poor memory, and problems with concentration. People with schizophrenia may have depression symptoms as well. Antidepressants are effective for treating these symptoms. Psychoeducation is another form of treatment, which means education and empowerment of the person and their family about their illness and how best to manage it. This helps reduce relapse. Family tension, a common result of trying to deal with a poorly understood disability, may contribute to a relapse in the person with schizophrenia, and psychoeducation can help avoid this. Another form of treatment is cognitive behavioral therapy. This type of psychological therapy can help reduce psychotic symptoms by helping the person to develop alternative explanations of schizophrenia symptoms, reducing the impact of the symptoms and encouraging the person to take his or her medicine. Assertive community treatment. Assertive treatment is an approach for people experiencing a more severe illness. The care of the person is managed by a team of health professionals such as the psychiatrist, a nurse, psychologist, and a social worker. Care is available 24 hours a day and is tailored to the person's individual needs. Support is provided to family members as well. Assertive community treatment has been found to reduce relapse and the need for hospitalization. Treatments for bipolar disorders. There is evidence that the following treatments help people with bipolar disorders. There are medications, and there's a large range of medications that can help people with bipolar disorders. These include mood stabilizers, antipsychotics, and for some people, antidepressants. And again, psychoeducation can provide information to the family and to the person about its treatment and management. And it has been found to reduce relapses when used together with the medication. There's also psychological therapies. There's two therapies that research has found to be helpful, and they are the cognitive behavioral therapy and the interpersonal and social rhythm therapy. CBT helps people monitor mood swings, overcome thinking patterns that affect mood, and function better. Interpersonal and social rhythm therapy covers potential problem areas in the person's life, like grief, changes in roles, disputes, and interpersonal deficits, and helps them regulate sleep and social rhythms. There's also family therapy. Educating family members on how they can support the person with bipolar disorder and avoid negative interactions can trigger relapses has proven to be helpful for people with bipolar disorder. A person who is experiencing severe psychosis may benefit from a short stay in the hospital to get back on track. Thank you for joining us, and for more information or to schedule an appointment, call 1-800-288-5912. And if you have any questions, please email us. Thank you for joining us.